Welcome to this IGS Health Initiative Explainer. So if you've recently held your newborn, you've probably felt it, right? That tiny, delicate little gap right on top of their head. Today, we're diving straight into the mystery of the baby's soft spot. We're going to talk about why it pulses, what it's actually doing, and exactly how you can care for it with total confidence.
Let's be real for a second. It is incredibly common to feel an absolute wave of panic when you first notice that small rhythmic dip moving up and down. I mean, it literally looks like their head is breathing. If you've seen this and felt your heart skip a beat, trust me, you are not alone in this.
Just listen to this reaction from a real parent. It's so weird and creepy though. I both love and hate it. Honestly, they hit the nail on the head. It is completely 100% normal to feel a little freaked out by this. But take a deep breath. We are going to look at the comforting medical facts together, and I promise it's actually pretty amazing.
So, what's going on under there? There are actually these fibrous gaps in a newborn skull, and that main one at the top is medically called the anterior fontanelle. Basically, it's just a sturdy membrane-covered space where the skull bones simply haven't fused together yet. And it's actually a brilliant piece of design. It allows the head to safely compress during birth, and crucially, it gives that beautiful brain plenty of room to grow.
Now, right beneath that protective membrane sits a major blood vessel. It's called the sagittal sinus. So what does that mean for you? Well, that visible pulsing you're seeing, it's literally just your baby's completely normal, healthy heartbeat pumping blood right through their little body. That's the whole shebang. Absolutely nothing to fear.
But, because it is so visible, it has become the target of so many misunderstandings over the years. Take the Yoruba tradition, for example. There's a cultural concept known as oka, which falsely blames the soft spot for serious infant illnesses, things like chronic sneezing or severe weight loss. From a medical standpoint, this is just flat out untrue.
It is absolutely vital that we clear this up. The soft spot does not cause diarrhea, it doesn't cause fever, and it doesn't cause weight loss. Unfortunately, because of these myths, some folks try to actually treat the spot. Please hear me on this. Never ever apply herbal concoctions, scarification marks, olive oil, or eucalyptus oil to this delicate area. It doesn't offer any benefit, and it can actually cause real harm to your baby.
Okay, so you might be wondering, when should I actually worry about it? Well, if you notice a slight bulge when your little one is crying their eyes out or lying completely flat or even throwing up, that is perfectly fine. Totally normal. But there are a couple of real warning signs that do require immediate medical attention.
We're mainly looking out for two major emergencies here. First, a deeply sunken soft spot. This is like a giant red flag for severe dehydration. On the flip side, a constantly bulging, swollen spot, especially when your baby is completely calm and sitting upright. Well, that can signal dangerous brain swelling or a serious infection like meningitis.
So, you want to watch for the physical symptoms that tag along with these dangers. If the spot looks sunken, check for dehydration right away. Are there fewer wet diapers, no tears when they cry? If it's constantly bulging, you're checking for a high fever, extreme sleepiness, or if they are just unusually, constantly irritable. If you see these combinations, you need a doctor immediately.
Let's give you a quick, clear nurse's action plan. Step 1. Calm your baby down, sit him upright, and just wait a minute to see if the spot normalizes. Step 2. Check for a fever and check those diapers for wetness. And Step 3. If that spot remains deeply sunken or persistently bulging while they are calm, do not wait. Rush to the ER immediately.
Just by understanding your baby's miraculous body, you are actively protecting them. You now know that the pulsing is completely normal. You know exactly which dangerous myths to ignore, and, most importantly, you know when to take action. So, what other newborn mysteries are keeping you awake at night? Let us know, and we'll dive into them in our next explainer.